Here we go. Recording. We are recording. The slides will be shared, the recording will be shared after the meeting. And I'm going to start just by offering our microphone over to Alejandro, who is here supporting us with simultaneous Spanish interpretation today. So he's going to speak about how we'll do that, and then we can get going.
Thank you. Como adelantado, como aviso en adelantado, estamos grabando y vamos a compartir la diapositiva y la grabación después, pero primero vamos a comenzar con la interpretación. Hola, mi nombre es Alejandro, seré el intérprete del español el día de hoy. Si ustedes prefieren escuchar en español, van a poder, todavía no lo van a ver, pero va a aparecer en un momento un icono terráqueo, que es como un mundo en la parte de abajo a mano derecha en su pantalla. Cuando vean eso, por favor asegúrense de seleccionar el español y después poner el audio original en silencio para que solamente escuchen en el idioma de su preferencia. Y con eso, muchas gracias por tenerme. Vamos a aprender la interpretación. With that, I'll pass it over to Emma to turn on the interpretation. Thank you.
Okay, we're good to go. Thank you so much. Welcome, everyone. We are so excited to have you here. I'm Emma Goforth. I'm the Mental Health Policy and Promotion Coordinator here at Adams County Health Department. We're going to get started here in just a moment, but wanted to orient you to a couple of housekeeping items. The next item that we haven't covered yet is our Jamboard. And I'd like to invite Saria, please, to show us how to do the Jamboard, and then we'll get going.
Absolutely. Okay, I'm going to share my screen here. Hopefully this works. All right, Emma, can you give me a thumbs up if you're seeing that? Okay,
We got it.
Sweet. Well, hello, everyone. My name is Saria Vijayasarathi. I use he, him pronouns. I'm a mental health promotion specialist working under Emma. So I'm just going to run us through this Jamboard, which we're going to use kind of throughout our time today. For those who haven't used Jamboard, even for those who have used Jamboard, hopefully this is a helpful primer for how to use it. There also might be a little bit of a cap in terms of how many people can get on. So if you're not able to get on right away, that's okay. We'll just ask folks once they've put their stuff on the Jamboard to go ahead and sign off, to just close it out of their browser so other folks can get on too. So Jamboard basically acts as a virtual whiteboard. So you can put sticky notes, comments, things like that on there. So that first page, once you get onto the Jamboard, is kind of our table of contents to help you, travel through this, this Jamboard here throughout our time. To be able to navigate to different pages, I'm going to show you just a quick example of how to add a sticky note. Later in our presentation, we're going to ask you to reflect on a couple of proposed agreements. So you can either go ahead and use this arrow tab over here, or you can expand the frame bar here, and you can move all the way to number 3. To be able to add a sticky note, which is how we're going to ask you to primarily engage throughout our time, you go ahead and go over to this left-hand bar here, click that sticky note button, and go ahead and type in your comment or your question or your reflection, hit save, and it's going to populate on the screen, and then just press cancel to get out of there. You can move your comments around, you can resize it however you would like. Just keep in mind that you can also access other people's, so just don't delete anyone else's comments or sticky notes. Throughout the presentation, since we have a lot of information, a lot of important information to share with you, we're going to ask that you keep any questions or reflections, rather than putting them in the chat, putting them in the Jamboard, because we will later go through them and answer them later on. So you can go ahead and go on over while we're going through the presentation. Slide number 7, this is where you put all the questions that you have for us, and we will go ahead and answer them afterwards. If we have to send those answers to you afterwards, we will. Slide number 8, feedback, just generally about the content or the facilitation or any requests that you have. You can go and put them there. This parking lot really is just, if you have a question, you don't really know where to put it here, and it can live here. That's totally fine. And then finally, we just have some prompts for reflection after our time today. So you can go ahead and put some comments down there on the Jamboard. So I hope that makes sense to folks. If you have questions about the Jamboard, feel free to drop them in the chat and I'll try to address them as we go. For now, we're just going to do a brief icebreaker here. I'm going to page on over to tab number 2. There we go. And we just have a quick question for you all today. How are you feeling? And if you could, go ahead and draw on which emoticon actually relates to how you're feeling today. So for example, I think I just put it here earlier today. You can go ahead and go over to this left-hand toolbar, hit that pen, and you can add whatever you would like. So I think earlier today I added this star here because, yeah, I'm feeling pretty good. So I'll go ahead and put that star over there and show that that's where I'm at. So if folks could, go ahead and go into the Jamboard, write down or make a little note or a little star by which emoticon refers to where you're feeling today. And then once you're done, go ahead and close out of the Jamboard so other folks can get in there too. All right. Well, we got a lot of smiley faces, so that's good. Awesome. Thank you all. Go ahead and keep doing that. Emma, should I turn it just back over to you so you can get going? All right.
Yes, please. Thank you. And thank you all for indulging us in that activity. It's partly to help us learn Jamboard and partly just to be able to check in since we are in webinar mode today. Partly because we had so many people register. We'd love to be able to see your faces and talk with you a little bit more, but we also wanted to have all people be able to participate. So with that said, I'm going to get back to screen sharing. And let's see, there we go. Are we seeing the screen okay? All right,
yes.
Great. So just very briefly, this is our roadmap for today. We have a lot of great information to share with you all. We will be taking some pauses to engage with you, especially in the Jamboard. And we will have a break midday, which will especially give you some time to share some thoughts and have some conversation there. And with that, I'm going to hand things over to Dr. Kelly Weidenbach.
Good afternoon, everyone. So great to have you here today. We're so excited. Thank you for joining us as we embark on this journey of addressing mental and behavioral health needs in Adams County. This is our very first Adams County Mental and Behavioral Health Community Forum. I'm thrilled to provide a quick overview of the new health department, and we'll be giving a high-level overview of important projects and programs and share some themes of recent assessments and community conversations. Rooted in health equity, we are committed to working collaboratively with community partners to address the complex challenges surrounding mental health. Mental health is a critical component of overall health and wellness, and we recognize it requires a multifaceted approach that involves everyone from healthcare providers to community organizations to individuals in our community. We believe that by working together and leveraging strengths of each partner, we can create a more supportive and inclusive environment that promotes mental and behavioral health. We're excited to hear your ideas and perspectives as we begin this important work, and we look forward to collaborating with all of you as we move to make a positive impact in our communities. Thank you so much for your participation today and your support, and I will move us forward. So as many of you know, the Adams County Health Department was born. This is our birth certificate on January 1st of this year after about a year's worth of planning with the dissolution of Tri-County Health Department. And I'm happy to say that we were able to open our doors with all of the services that Tri-County was providing in terms of client-facing services right out of the gate. And we were open providing those services that first week of January. And you'll hear more today about work that we're doing in the mental health and behavioral health space. And we're really hoping to kick things up and start leveraging some of the work that was done by TCHD and continuing to leverage work that you all are doing in our communities moving forward. Go ahead, Emma. So just an overview, many of you have seen a presentation that I've given in community forums already, but for those of you who have not, I just want to introduce our public health leadership team here at the Adams County Health Department. For those of you who are familiar with Tri-County leadership staff, some of these folks will be familiar to you. And then we also have some wonderful new additions to our leadership team. So I am the executive director and Dr. Bernadette Albanese, our medical director. We have Adam Anderson, our Epidemiology and Data Science Division Director, really a mastermind behind all of our data dashboards, maps, story maps, all those sorts of data products and reports. Monica Bulik, who's here with us today, who's our Health Equity and Strategic Initiatives Division Director, Michelle Harris, Nutrition and Family Health, Brian Hlavasek, Environmental Health, and Dr. Darcy Martinez, who's also here with Public Health Nursing, and Melissa Sager, who's our Assistant County Attorney. I'll just mention that most of the behavioral and mental health work the Health Department is doing falls under that Health Equity and Strategic Initiatives Division led by Monica Bulik. Thank you. Okay, these are just high-level vision and community objectives for the new Health Department, just giving you a sense of kind of what we're about and where we're going. So we're working to create a healthier and more equitable Adams County and address those disproportionate health outcomes that we know exist in our community. We're really looking to actively engage our communities in a different way and to ensure those strong relationships and build on trust. We're also really looking to continuously explore the role of the local health department in the communities that we serve, because that may change over time, and we're interested in hearing community input on what it is we should be doing, how we should be doing it, what interventions are maybe acceptable to the communities that we serve. And along with Adams County's overall mission, which is to be the most inclusive and innovative county in the nation, the Health Department is focused on innovation and inclusivity so that we're addressing those ongoing and new health challenges. Okay, so just a high level of overview. I'm not going to go through org charts for you all, but just a high level overview. We have 6 divisions within the Health Department. This includes Public Health Nursing, our Environmental Health Division, Nutrition and Family Health, Epidemiology and Data Science, Health Equity and Strategic Initiatives, and our Business Operations. We are now have about 190 total FTE and a budget of $30 million for this first year in operation. That does not mean all of that money comes from general fund from the county or from taxpayers. We do have a substantial amount coming from grants and other sources, but our overall budget is around 30 million. And I will speak to what these divisions do and what services you can see from them. So I'm going to focus first on our public-facing and client-facing services. So this includes our Public Health Nursing Division. So this is a lot of very traditional public health work, what we call Public Health 1.0, where we're doing direct service delivery in our community. So this includes a wide range of nursing and clinical services, including immunizations, sexual health and sexually transmitted disease prevention and treatment, family planning. We have the harm reduction and syringe access program, which is really focusing on reducing secondary and tertiary effects of IV drug use, for example. So looking to prevent HIV, hepatitis C, and other overdoses. Also the Nurse Family Partnership and Nurse Support Programs. Those are home visitation programs where our nurses are out in the field providing support to families in their homes and in other community-based settings. And then we have the Children and Youth with Special Healthcare Needs, which is a case management and referral program. Go ahead. And then also our Nutrition and Family Health Division. You will see one of our largest programs, which is the WIC program. So that's the Special Supplemental Nutrition Program for women, infants, and children. Nutrition support, breastfeeding support. We have a diabetes and education prevention that offers both diabetes prevention and also diabetes self-management, empowerment, education. We're also looking to expand our healthy eating and active living initiatives. And we also offer dual WIC and SNAP enrollment through this division. Environmental health, also very traditional public health roles, where we have our retail food inspections, body art facility inspections, school and child care, water quality and on-site wastewater inspections. So those are our septic systems, solid and hazardous waste. We do landfill inspection, industrial hygiene, and that includes everything from follow-up on children with high blood lead levels to meth remediation, to radon prevention, all sorts of stuff happening there. Also not mentioned vector-borne disease surveillance, where we're looking at mosquito populations for West Nile virus, for example. Go ahead. And then this is where we're starting, some of these new divisions are where we're really starting to garner into a more progressive public health space, really aimed at addressing social determinants of health. So I mentioned our health equity and strategic initiatives division. This is where we're really looking at prioritizing community needs and really looking at how we can assure the conditions in which people can be healthiest in our communities. And this is through programming, partnerships, policy, and really looking at the social determinants of health so that we're addressing health equity. And this includes, just really where we're looking at residents being able to attain their fullest health potential, irrelevant of age, race, ethnicity, gender, income, ability, or geography. So this is, again, where our mental health promotion program lives. Also our health equity and community engagement, public health policy, our health enrollment team and access to care, health insurance enrollment, maternal, child, and family health systems, tobacco, opioid, substance use prevention, community health promotion. This includes healthy communities, positive youth development, and social connectedness. We have some programming around healthy beverages. There's just a lot that this division has to offer in communities, and a lot of opportunity for us to work with partners with you all across the county. Thank you. In our epidemiology and data science division, this is led by Adam Anderson. We have our population health epidemiology, so really looking at population health statistics and outcomes, looking at risk and protective factors, understanding what the community health looks like. Our communicable disease epidemiology, which is our infectious disease case investigation, outbreak investigation, and control. We also provide education to different venues, public health emergency preparedness and response. Many of you are familiar with that in our role as local government public health and COVID. Also our public health informatics, public health project management, performance management, and quality improvement. Okay, to move forward. And I don't mention business ops there, but that's where all of our finance, budgeting, procurement, things like that are happening. So just in terms of us moving forward in our very first year of operations as a health department, we have some high level priorities, and you will see a strong focus on mental and behavioral health here in this first year for the health department. We're really looking to establish operational baselines for all of our programs. We're still putting a lot of operational logistic things in place and looking to expand services, expand our coverage, and assuring that we're meeting community need. We're also looking to become fully staffed. We still have a decent number of vacant positions that we're working to fill very systematically, and really getting us to that full 190 FTE. Later this year, we will be implementing or moving forward with a robust community engagement process for our community health improvement plan. So think of this as the health department's master plan, in which we work with community partners and create a collective impact plan, where we're really looking at what is it that will help us move that needle and make the community's health better. And so there will be lots of opportunity. I'll just tee that out for you all. There will be lots of opportunity for you all to participate in that process. And we'll be going through a prioritization process that's iterative later this year, with the hopes of finalizing that plan in December and having it approved by our Board of Health in January of 2024. Also on the list is completing a community-focused mental and behavioral health assessment for the county as a whole. This is really going to be service delivery focused. I get asked a lot of questions by commissioners, elected officials, other decision makers around what are the gaps in the community. And unfortunately, there is not a super concise source of information about mental health and behavioral health service delivery in the county. And so we'll be building upon some of the elements that BHA is providing and assessments that they're conducting. But really with that hyper focus on Adams County so that we understand where those gaps are and that we could start addressing them as a community together. And so that is ARPA funded. And then we will also be facilitating several other ARPA funded mental health projects, which you will hear more about later. And then our plan is just to really get out in the community, be visible, listen, engage with partners and our community residents and all the wonderful organizations that serve the community, and just really look for opportunities of working together, collaboration, leveraging our resources, and working on that collective impact. We will also be embarking on a journey to create our very first agency-focused strategic plan, which will be happening this year. And that will also, there will be opportunities for partners to be involved in the strategic planning piece. So Think It Community Health Improvement Plan is very external facing, work with partners addressing really complex health problems. Our strategic plan will be more internally focused and will help provide the foundation to move the department to where it needs to be in, say, three to 5 years. All right, so those are the big picture things for the new health department, and I will turn it over to Natalie to talk about some of the work around health equity.
Thank you, Dr. Kelly. Hello, everyone. It is so good to be here with all of you. Welcome. Whether you chose to be here today or you were voluntold to be here today, we are glad that you're here today. We are grateful that you're here today. My name is Natalie Salcido. I use pronouns she, her, ella, and I am the Community Health Promotion Manager at Adams County Health Department. I sort of live and breathe within the Health Equity and Strategic Initiatives Division. And within this department and within this division, we also have a Health Equity and Community Engagement Manager. Her name is Sylvia Kamal Small. She wasn't able to join us today, but I did want to call her into this space as well, as she does support this work and is someone who will be engaged in future convenings. Emma, next slide. And so to lead us into our community forum today, we chose to start with some of the foundational pieces and also the historical pieces that inform this work and really act as a compass or a North Star. And so, Emma, if you want to hit the click, we're going to start with an activity today. And this is a visualization exercise that we're going to start with. And so I'm not going to ask you to turn off your cameras because we can't see you anyway, but if you'd like, keep your camera off. What I'm going to ask everyone to do is close your eyes, and panelists, if you don't mind turning off your cameras, I will be the one that will remain on. Would like to just create a space for folks to feel safe and comfortable as we walk into this next exercise. And like I said, it's a visualization exercise, and the visualization piece is really important. And so to do that, we're going to close our eyes, and you don't have to do it yet. I'm just going to explain the components ahead. So we're going to all take a deep breath before we go into the exercise. And the exercise, I'm going to ask you to imagine 3 scenarios. And so before we do that, if everyone wants to close their eyes, I'm going to walk us through a deep breath. We're going to count for 4 in, we're going to hold our breath for 4, and then we're going to release our breath for 4. So if you'll join me in this, we're going to close our eyes and I'm going to count us through. We're breathing in for 1, 2, 3, 4. We're holding our breath if you can for 1, 2, 3, 4, and we're releasing our breath for 1, 2, 3, 4. Now you're going to keep your eyes closed, and I want you to imagine these 3 scenarios. You are late to catch a flight. You rush through the airport, you make it through security, you run to the gate, you make it down the jetway, you step onto the plane just as they close the doors behind you. And the pilot steps out of the cockpit to say hello. You get to your destination, you go to a local restaurant, and you have the best meal of your life. Sitting at the table next to you is a couple happily celebrating their anniversary. The next morning, you go to the biggest technology conference in the world, and the CEO of this year's hottest tech startup just took the stage to speak. Now you can open your eyes or you can keep them closed, but I'm going to ask you to imagine the mental image in your mind. Was the pilot who stepped out of the cockpit to say hello to you Black? Was the married couple happily celebrating their anniversary two men? Was the tech CEO that joined the stage to speak a woman? Now I'm going to share a little bit about why we did this exercise. We know that one of the biggest stumbling blocks to achieving true equity and justice is unexamined conditioning or behavior, and this belief that we are treating everyone equally in our minds when in reality we're not. And when we stop and examine our own conditioning, we can catch ourselves having different reactions to and expectations of people simply because they don't look like us or because they don't identify like us. And the idea with this exercise, or what it speaks to, is that if we can set aside our bias or our judgment long enough to remain curious, and we can remain curious long enough to ask ourselves a question or ask that mental image a question, we are much more positioned to do this work. And so you'll see on the screen, and Emma, if you would click to the next one, there's 3 practical tips to addressing unconscious bias. I did not make these up. They did come from Valerie Alexander's TED Talk, which you will get these slides and can use this exercise. My hope, of course, is that some of you see this as a powerful jumping off point to rooting and centering ourselves in equity. And so you'll see up there's visualizing situations before they happen. Whatever mental picture you get, remain curious about it, examining our own judgments, asking ourselves, how would we handle this interaction if this person looked like me or identified like me? And then normalizing our views on what we maybe have a mental image of is unexpected by consciously increasing our exposure to such things. So thank you for entertaining that activity. I hope some of you, like I said, will use this exercise in the places and spaces that you find yourself in. Emma, next slide. All right, so there's those proposed agreements, and this is the first space where we will use the Jamboard, but no need to hop in there yet. I'm going to just start us off by recognizing the importance of collectively developing our agreements with each other and recognizing that these agreements are foundational to how we do this work. And at this time, these are simply proposed agreements. I'm going to walk us through each one and talk a little bit about what they mean, with the intention of hearing from all of you about what really resonates with you. What agreements would you add if these were our agreements with each other? And what agreements might you challenge that I'm going to share today? The way we're going to capture that information is through the Jamboard. Again, no need to hop in there now, but the first one you can see on the screen is taking care of ourselves. So we really believe in creating a space that encourages wellness and recognizes the importance of caring for ourselves in order to best care for others. We also recognize that the topics we intend to discuss are of sensitive nature. They may be someone's lived experience or may stir up emotions inside of us that require our attention. And so if you need to step away, if you need to get something to drink, if you want to walk your dog while you listen to us, we respect that. And we will have a 10-minute break halfway through for some self-care, whatever that might mean to you. And in the future, we would love to integrate the meaningful ways in which you all take care of yourselves. And so the Jamboard is a space and place where you could tell us all about that. The second proposed agreement is leaning into the uncomfortable. And at Adams County, we are committed to leaning into the uncomfortable and actively listening. Many of you have likely heard the quote, "Growth begins where our comfort zone ends." And we recognize that although this afternoon it's more of a webinar style, it's more information-based, we will create the space in future sessions where we'll become comfortable with being uncomfortable and having critical and hard conversations. The third is what is learned here leaves here. And we recognize that it's important that we ensure as a public health agency that the material that we're sharing, whether that be data, a framework, a strategy, whatever it might be, a PowerPoint, that it's digestible, it's accessible, it's inclusive, and it's equitable. And that requires ongoing improvement. It requires innovation with community, not for community, and internally as a health department. We hope that you walk away today with at least one new thing you learn that you will pass along or take action on. And the fourth agreement, and these are not comprehensive, of course, this is just a starting point, but the fourth is a story is the author's to tell. And that is our commitment to elevating the voices of those with lived experience and those disproportionately impacted by mental and behavioral health challenges. Some of you are in the virtual room this afternoon. Some of us are in the virtual room this afternoon that have been impacted by mental and behavioral health challenges. And statistics alone tells us that 1 in 5 people in the United States will experience a mental health challenge this year, with symptoms ranging from mildly disruptive to severe, depending on the condition. And as we know, it is important that we tailor our efforts to include language justice practices, culturally relevant materials, and an emphasis on equity, diversity, and inclusivity. And so with that, I see that Saria dropped the Jamboard in the chat, and I am going to give, well, Emma, I'm going to check with you. Can we give folks a couple minutes to hop into the Jamboard and add some pieces to this, or would you like me to carry on?
I think for the sake of time, if we can keep moving, and we will remind you all of this location. We'll have a little time during break. If we pause now, we may not have a break.
Great. Well, thank you. I did want to check in with you. You are welcome to hop into the Jamboard if you feel compelled to answer those questions now, or you may reflect later, to Emma's point. So the next piece is when we say equity and we say justice, or social equity and social justice, what do we mean by that? One way to tell this story is through the image on the screen. And I'm guessing many of you have seen this image or a version of this image, or maybe you haven't, and this is the first time you're being introduced to this image. What we're going to do is we're going to visualize equality versus equity versus justice. So we can see in the image that there are 3 individuals with different heights, ages, and abilities standing behind a tall fence, trying to see over it so they can catch the baseball game. Equality, as you'll notice on the left, is giving everyone the same box, same size box, to help them see over the fence. This makes the assumption that everyone benefits from the same supports. Equity is giving each person what they need to see over the fence. For example, our friend on the right needs 2 boxes, whereas our friend on the left does not need a box at all. Our goal is to go beyond this and remove the fence altogether. And you can see that that is depicted on the right under justice. And removing the fence is removing the systematic, structural, and institutional barriers where people's health is no longer determined by the social determinants of health. Of course, there are multiple ways in which partners are defining equity and health equity. And Emma, if you'll put on the slide, we are sharing 2 examples on the screen and intend on really being intentional and working with community to define this further. And so you'll notice on the slide, an equity definition from the Colorado Department of Public Health and Environment is when everyone, regardless of who they are or where they come from, has the opportunity to thrive. And we know that this requires eliminating barriers like poverty and repairing injustices in systems such as education, health, criminal justice, and transportation. And for general purposes, health equity is defined as when everyone has the opportunity to be as healthy as possible. And as such, we recognize that equity is a process, and it does require us examining our policies, our practices, our processes, and our procedures through the lens of equity and with the vision of removing the fence or systematic barriers altogether, as shown in the image. Next slide. So how do we do this work? Many of you, I'm sure, have heard of, or maybe know even more in depth, the concept of collective impact. And we won't get into that much today, but a foundational piece to our work together is our commitment to authentic community engagement. And you'll notice the graph is a depiction of the community engagement continuum. This is just one example. While we recognize that relationships move at the speed of trust, we are committed to building the systems, structures, processes necessary to ensure authentic community engagement. And you'll notice the arrow at the bottom is pointing in the direction that we are headed, which is to collaborate and share power with community, but make the opportunities available for community to engage with flexibility. Meaning if there are community partners or members that simply want to be informed, there's opportunity for that. And if there are community members and community partners that want to share power or collaborate, that there's opportunities for that as well. And the next slide, and I will be finishing here and passing it along. This is just a brief overview of the current and future state of this work. This is not comprehensive, but an important piece we wanted to share with you today is really the idea of sort of this internal health equity group and our current exploration of this. Below, you'll notice there are 3 examples of activities that are foundational to a working group in this capacity, and really where we're headed in this space, which is adapting a land and labor acknowledgement with Adams County community, adapting a shared language guide with Adams County community, recognizing that language does matter, and embedding equity in strategy and goal setting. You'll notice the SMART goals to the SMART T goals. If you're not familiar with the SMART goals, you'll notice they're defined there, but they're specific, measurable, achievable, relevant, time-bound, and they're also inclusive and equitable. So with that, I'm going to pass it off to you, Emma.
To me. Hello. Thank you, Natalie. Appreciate your work on that. And yes, we do hope we'll have some time for reflection on some of those areas of proposed agreements, as well as just concepts in general. That said, we are going to move into a little bit of information sharing that is focused on some of the work that has been done here in Adams County. And much of this work has been done in partnership with you all through Tri-County Health Department. So you'll recognize some of us who came to Adams County Health Department from Tri-County. We have some new faces as well, but really wanted to just make sure that this group had an opportunity to reflect on some of what we have learned and understand to be true about mental and behavioral health in Adams County as a foundation for our work moving forward. So to just start off, I want to recognize that over just the last 3 years, we have engaged with many of you and many others through a variety of channels, and we want to highlight 2 here today. So you'll hear us talking a little bit more here in a moment about the mental health and suicide prevention, gaps in assets assessments and recommendations that came forward from that. Callie Preheim is also going to share more information about our community health assessment. So you can see some numbers here in terms of ways that we have engaged with various partners, as well as just the participation there. So we've done quite a lot of work to outreach, and we have much more to do. This slide is just a quick snapshot to acknowledge all of your work and those who have been participating in these efforts. So the blue indicates folks who participated in the community health assessment process in 2022 with Tri-County Health Department. The green are folks who have participated over the last 3 years with our mental health and suicide prevention assessments and framework development. And then those with the asterisk stars were involved in both of those things. This is just a snapshot. There are others who have been involved. We apologize if we missed anyone, and we certainly intend to include more going forward. This slide is just a quick snapshot of some of the work that's happened around the mental health and suicide prevention assessments and frameworks. And so you can see starting back in 2019, Tri-County Health Department engaged in contracting with a vendor, as well as putting together an internal advisory board to help us start to gather some information and resources to help us understand the current state of mental health and suicide prevention needs. In early 2020, we began to do this gaps in assets analysis. Many of you met with us and our contractors for key informant interviews, answered surveys, all at the onset of the COVID pandemic. And we really appreciated you all continuing to prioritize these topics during such a time of change. During 2020, we developed frameworks, which we'll tell you a little bit more about here in a moment. And we also really focused on staff and community supports in sort of in reflection and of the need from the pandemic. In 2021, we continued to engage. So we shared these frameworks, we gathered feedback, we offered trainings both internally and externally. We held a variety of community town halls where we had lots of discussion with you all. And we worked on getting information out through the Tri-County website. And then in 2020, we were very well poised to bring the frameworks to life or to action. And in the spring of 2022, we held a community summit, which many of you supported us with, that was really framed around how we begin a collective impact approach to work together, both in Adams and Arapahoe counties, to improve mental health and suicide prevention efforts. Many of you know, and as was acknowledged earlier, during this year, the Tri-County Health Department began the process of dissolution. And so some of this work paused as we learned more from each of the counties in terms of how structure was going to come together, where staffing was going to be. We did continue to engage, talking with you all about data, and certainly appreciated that. So this is just a quick snapshot of some of those pieces. So we did this asset and gaps analysis. We developed the frameworks. We talked with you all over a couple of years period of time. Some of what we learned from all of these assessments had to do with strengths and assets. So it's not all bad, and we certainly want to acknowledge where things are working. So we heard that there is a growing awareness of mental health as a community-wide issue. We heard that stigma is decreasing. Spoiler alert, we also heard there's still lots of work to do on that, and we'll talk about that on the next slide. We saw collectively an increase in applying trauma-informed approaches. We heard from folks who do access mental health services that they help. And we also heard a growing focus among many of you all on prevention and upstream approaches. That said, we did hear a lot about ongoing challenges. And so some of these that are that we heard from Adams County partners and residents, that there is limited awareness of what mental health resources and services exist. And this was at the organizational level as well as for individuals. We heard about limited options and choice of mental health resources and services, and related to that, this limited understanding about eligibility and fit with available mental health services. Some themes that came out through both of those challenges had to do with cultural relevance, linguistically appropriate and available, really having that ability to choose and have multiple choices for the resources and services that are needed. We heard about cost. We did hear about a lack of a comprehensive cross-sector collaborative group. We heard that transitions of care are either inadequate or just not happening, unsupported. And then, as I mentioned before, while we were seeing some improvements in stigma, we are definitely still experiencing ongoing stigma about poor mental health. We also talked with you about how public health can support in this space. And what we heard from you all is that we can share data, especially as we work to understand disparities and equity issues and sort of intersects between social determinants of health and our experiences with mental and behavioral health. We also heard that there is a strong need for a convener or a connector to bring people together to ensure that we have cross-sector, multi-partners really working together. We always want to root our work in the evidence base and research base, and policy is a major element of the work that we do. And then lastly, and this really came out of our summit from this time last year, we heard that this collective impact approach is really going to be essential for our desired outcomes, that many of you are interested in joining groups, and that everyone that we talked with wanted to stay in communication about these efforts. I will note that in our registration list, we didn't have anybody who said no to joining our email distribution list. So we will be in communication with you all. And then I just wanted to highlight this quote here from one of our Adams County participants that really recognizes that having us all on the same page in terms of our direction and how we communicate will be the way to go. I also want to acknowledge the Tri-County Overdose Prevention Partnership. So this has been a long-standing partnership of public and private partners who have been working primarily towards overdose prevention across the Adams, Arapahoe, and Douglas counties. You can see the mission here, which is really to do collaborative work with local communities around prevention and treatment strategies. And the goals are to decrease overdose deaths, increase awareness and knowledge of prevention and treatment strategies, and work to increase engagement and responsiveness among communities. The TCOP work has been structured around these 6 strategy areas. I won't go over them in detail here, but this has been a way that this work has been structured. And historically, TCOP was facilitated by the Tri-County Health Department, and much of the work did focus on opioids, prescription drug misuse, and overdose prevention. At the time of Tri-County dissolution, we had input from partners that you all are interested in continuing this work, but we have yet to identify new backbone support. So I'm going to plant that as a thought seed for you all in terms of ways that we can perhaps support you all going forward from Adams County Health Department. So all that to say, a fair amount of history there, and I'd love to pass it off to Kelly Preheim, who's going to tell us about our community health assessment.
Kelly, we're not hearing you.
So while Callie is working on her sound there, I will just mention that throughout the presentation, you can see on this slide, we have tried to embed links to all of the resources that we're talking about. So you will have access to these links. You can read much more in detail. Callie?
Hi, can you hear me now? Sorry about that.
Yes, thank you.
Okay. Okay, Emma, please go ahead and advance the slides. It's nice to see so many of you again. I'm glad to be here. I'm just going to talk briefly about our community health assessment and our community health improvement planning process, which Kelly mentioned briefly in her introduction. We are moving forward with the community health assessment that Tri-County Health Department completed in 2022. The community health assessment and the community health improvement plan are both guided by state law as well as the Public Health Accreditation Board. They're something that health departments complete every 5 years, and they're guided both by FAB, and the state has a Colorado Health Assessment and Planning System. Next slide. Thank you. So this is the cover of the community health assessment. Again, the link is here, and Surya, would you mind putting it in the chat as well? I will do that later too. It's organized into 13 main sections. Kind of 4 sections are bolded on this slide, and I will be talking about 2 of them, mental health and substance use treatment. Emma, next slide. So as we know, mental health impacts how we handle stress, relate to others, make choices, and it impacts and can impact our risk for other chronic health conditions. The graph here on the right looks at the percentage of people reporting 8 or more poor mental health days in the past month. We're looking at data from 2013 to 2021. Adams County is in the light blue, and Colorado is in the green. In 2021, almost a quarter or 23% of Adams County residents reported they were in poor mental health. We've been seeing an upwards trend. Obviously, you can see it over the past couple of years with a 39% increase between 2019 and 2021. These data come from the Colorado Health Access Survey, which the Colorado Health Institute completes every 2 years. Let's see, I also wanted to mention, it's not on the slide here, but in 2021, also from the Colorado Health Access Survey, 15% of people who said that they needed mental health services in Adams County did not receive them. Of those folks, 54% said that they had a hard time getting an appointment. 52% said that it was because of cost. 50% said that they didn't feel comfortable talking about personal problems. And 31% said that they were concerned about what would happen if someone found out. So like Emma said, stigma still is playing a role in people accessing mental health services. Okay, next slide. And substance use. So like other diseases, a combination of behavioral, biological, and environmental factors increase the risk for developing addiction or engaging in substance abuse or misuse. This graph here on the right looks at age-adjusted death rates per 100,000 people over time, so 2017 to 2021, for various substances, sorry. So we're looking here at prescription opioids in blue, heroin in the kind of burgundy color, fentanyl in yellow, and methamphetamine in green. Between 2020 and 2021, age-adjusted death rates increased for all causes of death, but most noticeably for fentanyl deaths, which increased 107%. Again, that's the yellow. Prescription opioids, which increased by 95%. Those are the blue. And then methamphetamine deaths, which increased 58%. Adams County is proactively addressing opioids and has additional funding coming in from the opioid settlement. And my colleague, Susan Keithley, will be talking about this a little bit more in the presentation later today. So that's it for the community health assessment. I hope that you will dig into this a little bit more if you're interested. And again, Surya put the link in the chat, so thank you.
Thank you, Kelly. I guess just in wrapping up, I will say that this is a very long, dense document of what Kelly just shared. It's just a very high level snapshot of just a handful of data points. We certainly encourage you to dig in deeper. This is a driver of the way that we will prioritize some of our work going forward. And also just want to promise to you, and you all can hold me accountable to this, that we will create space here very soon for partners to spend time with data for Adams County so that we can really understand more around these issues. We did not have the space to do that today, but just want to acknowledge that that is an important piece of what we want to do with and for you all, and to really have some discussion about that data. So with this, we're going to move forward into just a brief overview of some of our foundations. And so I think this was acknowledged on one of Kelly's slides as well, but we recognize that all people have biological, psychological characteristics that may make them vulnerable to or resilient to potential behavioral health issues. And these characteristics exist in multiple contexts, like relationships and communities and society. And we need to have ways of addressing these factors in all of those contexts. And so this is just an acknowledgement that at all of these levels, we need to be working together to promote positive mental health and wellness, and to prevent substance misuse and suicide. No one has the one answer. And so we must work together with complex solutions to address complex issues. As I mentioned before in the timeline and history, we did work together with many of you as our community partners to develop some frameworks around mental health and suicide prevention. There is also a framework that was developed through the Tri-County Overdose Prevention Partnership. And here in a moment, Surya is going to dig into those a little bit deeper and share some of those details, but really just wanted to recognize that these frameworks are designed to act as a catalyst for implementation of strategies that we share across various sectors, as well as many partners, where we are all working together in the ways that we can really provide our strengths and our resources to make those improvements. And so these frameworks help to provide some clarification about how we do the work, the principles and values that we are rooted in, and then give us a start to begin to prioritize some of the strategies across a continuum, all the way from wellness through prevention, clinical services, as well as recovery. And we certainly see that public health can be a strong partner with all of you through that. So with that said, I'm going to pass things off to Surya.
Awesome. Thank you, Emma. And folks, can you hear me okay? All right, perfect. All right, so again, my name is Surya, he, him pronouns. So for the next few minutes, I'm just going to guide everyone through a deeper dive into these frameworks. I'll preface by saying there's a lot of info here, a lot of text on these slides. So my job for the next 10 minutes or so is really going to be to help us to hone in on the key ideas, the big ideas on these frameworks. But we really encourage everyone here, we just dropped the links in the chat as well, for you afterwards to go back and revisit these frameworks. Immerse yourself in these concepts because they are very, very important. Also, feel free to jot some notes down as we go, things that stood out to you, things that are connecting to your work specifically, because we'll have some time at the end, hopefully, for you to reflect a little bit through the Jamboard as well. So let's start with that mental health framework, as you can see here. On that left-hand side of the screen, we've got the steps along the mental health continuum with those key strategies for each step. We're going to leave that to the side for now, and we're going to focus in on that right side of the graphic here, those rings. We'll start with that white center ring, and if you could advance the slide. So addressing mental health and suicide effectively really requires multi-sector strategies across the social ecology and along the spectrum from health promotion to early intervention, treatment, and recovery. And this North Star at the center of our ring is where we find those unifying concepts that we're striving towards, the concepts that are central to collective impact and to building a common agenda. So what are those core principles? You can see they're kind of in the top right there, kind of hard to see. So we've really blown them up on the bottom left, and you can see them very clearly, those 4 pieces here. And let's start with the top, social and institutional equity. It's intentionally at the top here. I mean, we spent so much time during our time today really rooting ourselves in these concepts of equity and health equity, and that's for good reason. And what this means for mental health is understanding, identifying, and eliminating those disparities that are originated from and perpetuated by policies, organizations that routinely advantage white, heterosexual, cisgender, and Christian people. This ties into community-driven solutions, where we're developing strategies meaningfully with partners and with communities that are really rooted in the community strengths and their unique needs. Data collection and evaluation is also critical here, that the fact that the strategies that we have need to be built around and supported by current, culturally relevant research and evidence. And finally, at the core of our work is a fundamental recognition that this work is not done in silos. It requires authentic multi-sector partnerships with mutually reinforcing activities, accountability, and strong communication. Next slide, please. So those are really great concepts to root ourselves in, but how do we actually see ourselves doing this work effectively? Now, as we move out to this yellow ring at the center, we outline 5 key elements for doing this work effectively. Number 1 is data, not only identifying the issues in the communities who are impacted, but also to advance partnership goals and to report progress towards those goals. We also need an action plan, clearly answering those questions of what goals are we accomplishing, what results are we looking for, and when do we think we can achieve these results and how. Sustainability. How do we ensure that the strategies are not only effective, but that communities continue to reap the benefit of that success going forward? And key to that are resources, marshaling together the community assets and our partner resources in pursuit of those common goals. And to support and channel this work, we also need effective leadership to design, to implement, and evaluate the initiative. Next slide, please. So if those previous rings really talked about the why and the how, this ring, this orange ring, really centers on the who. And these are the 3 human-centered values that inform the actions we take and the decisions that we make together. So being person and family-centered really revolves around the idea that people and families make the right choices for themselves, and that often the solutions that we're looking to help with, the solutions that we're looking for the problems that families face are actually within those families themselves. And we scaffold this very person-centered approach with this idea of serving communities more holistically. When we talk about being a whole person or whole community, we're really talking about an upstream application of resources to address the social determinants of health, understanding the people in the communities that we're actually serving and coordinating services across sectors. And finally, we value being trauma informed. We acknowledge the impact of trauma and adverse experiences on victims and survivors, on entire communities, and we shift practice intentionally to be able to move towards institutional knowledge of trauma and healing. Next slide, please. So for now, we're actually going to skip over that 4th layer. We're going to come back to it in the next slide. Let's instead focus on that outermost blue layer. And these are the outcomes that we're working towards to achieve a mentally healthy and suicide-free community. So this ultimately starts with hope, for individuals to have hope for their future and for the future of their families and their loved ones. Wrapped up in that feeling of hope is a feeling of belonging and connectedness with family, with community, and with culture. Next is purpose, the idea that people move through their daily lives with a sense of purpose driving them. And finally, that they have a sense of meaning in their life, and that they know that they have a part to play in creating their community and creating a rich heritage and history for those who come after them. Next slide, please. So that 4th layer that I told you we're going to put a pin in, we're going to come back to that, and that's that right here. So we've blown it up here so it's a little bit more visible to allow us to really dive deeper. And this layer of the framework describes the components of the mental health continuum, as Emma mentioned, from promoting positive mental health to preventing the onset or progression of mental health and substance use disorders, or poor mental health, to treatment interventions, and finally to recovery from disorders or poor mental health and the reclamation of good mental health. Next slide, please. So each of those steps that you saw has key strategies within those frameworks for supporting individuals and communities through each step. And what we're going to do today, actually, just in the interest of time, we're just going to hone in on that first step. So mental health and wellness promotion, and kind of treat it as a case example. Emma, if you could advance the slide here so we see that nice little animation. Yes, there we go. So we're zooming into that one. But later today, please, I'd encourage everyone to go back through, read through those other 3 steps in the framework, particularly as they relate to the work that you do in your organizations. So let's go to that next slide and let's dive in here. So mental health and wellness promotion. I'm going to ask that we just focus our attention on the right side of the graphic here. We've included 3 strategies for embracing health in all policies, improving community connectedness, and supporting employees and families. And I want to note that while we only have 3 strategies here, this is not a comprehensive list of how we can engage with one another. It's not a comprehensive list of how we can promote positive mental health and wellness. It really just are the few examples we wanted to highlight through this framework. So in particular, what we want to focus on is that one that we've highlighted, embracing health in all policies. This is a priority not just for behavioral health, but also for Adams County Health Department in general. We're one of the few health departments out there that's really invested in developing an intentional policy platform. And you're going to hear more about that. We have a generally funded, legislatively focused senior policy advisor, Michael Ruddick. He's going to be talking to you later. And he's also going to be asking for you all to reach out to collaborate, to engage with him on these issues as well. Next slide, please. So that wraps up the mental health framework. let's just touch briefly on the suicide prevention one too. As you can see, you can go to that link and check it out. This is pretty similar to the mental health framework, just with some key differences here. So this one contains key strategies specific to reducing the incidence, the prevalence, and recurrence of suicidal ideation and behavior. And like with all prevention, these strategies really focus on mitigating risk factors and increasing protective factors for suicide prevention. And really, when we look at this, we're looking at, instead of recovery and reclamation, we're looking at postvention and recovery. And postvention really just refers to support services for those who have lost a loved one to suicide. Next slide, please. So we're going to do the exact same thing we did with the mental health framework. We're just going to dive into one key step of the continuum here, suicide prevention. Again, just a reminder, this is not a comprehensive list. It's just 3 strategies that we really chose to highlight here. And the one that we want to make sure we highlight specifically is that top one, reducing access to lethal means and increasing lethal means safety. We're talking about firearms mostly here. And this is another legislatively oriented strategy to reduce the incidence and prevalence of suicidal ideation and behavior. And this really goes back to that larger strategy we just talked about embracing health in all policies. Next slide. So to wrap up my time here, I just want to briefly touch on this TCOP framework, the Tri-County Overdose Prevention Partnership Framework. We really felt as a team that it was important to celebrate the fact that a lot of people here on this call are not just aware of this framework, but also had an active role in helping to create and implement this framework. And the frameworks that we just went through around mental health and suicide prevention were intentionally developed to complement this framework because there's a lot of common DNA between these. And the one thread I really want to leave you with is this idea of having a commitment to a comprehensive, data-informed approach that works across the mental health continuum. Next slide. Okay, so we have a few questions in the Jamboard for you all. I think it's slides 5 and 6. Just to put some notes down about words or phrases that stood out to you about the frameworks, the exciting connections you saw between your work and these frameworks. Definitely encourage you all to go ahead and write your reflections down in there. But for now, we're going to go ahead and move into that break. Emma, if you could advance the slide here. We said 10 minutes. Emma, do you want to keep it as 10 minutes and have everyone come back at 2:20?
I think, can we do an 8-minute break and
Sure.
just leave a couple off there? So we can come back at 2:18. We encourage you all, as Natalie mentioned earlier, to please take care of yourselves, whether those are bio needs or emotional needs. Please use the time to contribute to the Jamboard. Let us know what questions are coming up. It's definitely a lot of information that we just went through, a lot to process. So do what you need to do to take care of yourselves, and we will see you back here at 2:18. Thank you all so much. Okay, my clock says 2:18, so let's go ahead and get started. Welcome everyone back. We appreciate you taking your time to add to the Jamboard. There's a few things in there. I hope we'll see some more. I'm going to go ahead and hand things off again to Ms. Callie Freeheim.
Thanks, Emma. Great. So I talked about the community health assessment before. Now I'm going to talk about kind of where we are in the development of the community health improvement plan. Next slide, please. So we are in the process of, in the planning process for the community health improvement plan. As Kelly mentioned earlier, CHIP is really the community-centered plan to address the county's health priorities. It's guided and implemented through collective action. Probably many of you have been involved in either a community health or public health improvement plan in the past, or for our health system partners, a community health needs assessment and their related plan. Next slide, please. So we want to be intentional about partnership, and we really want for this plan to be community-centered. So we're partnering and engaging with community in a couple of ways, including funding local CBOs to engage with community members with whom they're already connected, specifically through focus groups and surveys, by creating a community coalition for health improvement, which will be kind of the guiding force and guiding body behind the CHIP. So this group will develop the goals, objectives, and strategies for the final priority areas. And we are working actively on an open call for folks who are interested in participating on this coalition, and it will be coming soon by the end of the month. And then finally, by the creation of a community advisory group, which will form this fall and include both community members. In fact, we really want the majority of people to participate to be community members, but also for partners and colleagues. And more information about that will be coming later this year as well. Next slide, please. So this slide is really busy, I'm sorry, but I did want you to see how the different stakeholder groups, I guess who they were and how they're interacting with each other over time. So on the bottom, we have kind of the yellow areas, which are the different CHAPS phases that we're working through. And then it takes you from January through kind of early spring of next year. So we have an internal planning group. We have the Coalition for Health Improvement, which is getting going, the community advisory group. We have community themselves. We have our CBO partners through the funded partnership. And then we have kind of meet and greet with county groups. Next slide, please. So there are many ways to get involved, and we hope you'll be able to participate in at least one of these. So these are kind of the main things I've already mentioned: the Community Health Coalition, funded CBO partnership, survey participation, and then the community advisory group. In addition to these, the last kind of area on the last slide was meet and greet. So we are looking to go out to existing groups, to talk to existing coalitions, go to your meetings, kind of have discussions about the results from the community health assessment, as well as just what you see in your work, working with community and trying to understand how we can work together better to address our health issues, as well as kind of amplify the opportunities that we have. So if you have any questions, this is my contact information, and I will put also the website link where the community health assessment is saved, as well as the webpage to which any of the open call documents will be posted. Please feel free to reach out to me. My contact information is also on that page. Thank you.
Thanks, Kelly. I will just note briefly that there will be sort of a complementary timeline of the mental and behavioral health to what Kelly just showed. And so we invited her here today, one, because we obviously are planning to reach out and we'll be engaging with you all for that process, but also just wanted to recognize that we really intend to be in tandem, walking together in our engagement, and really thoughtful about how we do so, topics specifically, as well as for the overall CHIP plan. But I will hand it off to Monica Bulik now.
Hi, thank you. My name is Monica Bulik, she, her, Ea. pronouns, and it's great to be here. I have the role of supporting our community health promotion and behavioral health team and all of our health equity and strategic initiatives division within Adams County Health Department. And you can go to the next slide. I'm going to talk today about the ARPA funds that Adams County government received. The first round of funds were released responsively to meet the immediate needs associated with the crisis of the COVID pandemic. The second round of funds were very strategically directed toward those areas that Adams County government knew were priorities in the community, of which one was behavioral health. As a result, we looked at the previous assessments and planning work that had happened within Adams County. And you will note here that Emma has talked about a lot of these. They were rooted in what Tri-County has done and that which we are carrying forward. Additionally, we looked a lot at the state of Colorado's Behavioral Health Administration's assessment and the blueprint for reform, recognizing that what we do as a county can complement that which is happening at the state level and really leverage that which is happening at the state level and bring it here to Adams County. The other thing that hasn't been mentioned yet is the great work of the Strengthening Families Partnership, and that they have done a lot of collaborative work over the years to boost the protective factors amongst young children, reduce the risk factors to focus on primary prevention of behavioral health needs in the future. All of these assessments led to the ARPA funds that we identified. Next slide. Collectively as a county, the following projects were identified to be funded. First, as Dr. Weidenbach mentioned, we will be mapping services and supports specifically related to treatment of behavioral health. Emma alluded to the fact that during their findings, understanding of the services and knowledge of how to access services, and quite frankly, understanding how accessible they were culturally as well, were some of the opportunities for the future. And so we will be doing an assessment here the rest of this year to understand more so what services are available and how people are able to access them and how they translate to accessibility for all of our communities. Then from there, we will respond by looking at that assessment, understanding the gaps, and invest $3 million to start to address those gaps, recognizing the collective nature of the work. Both of these are really service-based. Additionally, we identified that there are a lot of co-responder programs in Adams County, but they aren't equitably distributed throughout the county, and they aren't reaching everybody. And there are a lot of there's a variety of funding sources going into these co-responder programs. We know that co-responder programs, whether they be with law enforcement or first responders, are critical to reach people appropriately at the right time so that we can have people-oriented solutions and getting people to the services they need. And so we will be identifying the co-responder programs that are available, offering funding to fill the gaps where there are not co-responder programs. And Adams County Health Department will be convening those organizations and partners that do have co-responder programs to share best practices and establish a learning community so that we can evaluate the work and create the case for sustainability over time based on lessons learned and the outcomes that we're seeing. Also, I want to recognize the Adams County Community and Safety and Wellbeing Department. This department is a key partner in the work that we do, and they receive funding to do a mobile mental health and human services unit to reach people experiencing homelessness in our community. And so they will have a co-responder program with park rangers to reach those who are harder to reach in our communities and also need to receive the same person-centered care of the right response for the right people at the right time. And then you're going to see here, all of these, the ones I've described so far, are very care-oriented. And that is because public health does have a responsibility to understand the landscape and make sure that we're filling gaps and making sure that the systems of care are reaching people in the right ways. We also, it's as Emma elevated, need to focus on prevention. And a lot of this, the prevention work, will be identified through our community health assessment and implementation process that Callie Preheim just described. So we will be learning a lot more about how we address our preventive efforts in the future through the CHIP process. We did know that the Strengthening Families Partnership is a key convener focusing on early childhood prevention. So there is funding going to the Strengthening Families Partnership to continue their work to reduce risk factors, connect families to the available resources, and promote social cohesion and protective factors. So funding will go to the Strengthening Families Partnership to continue this work and embed an evaluation so we can see and understand how things are working and what our community needs to continue to do moving forward to protect our children in early childhood and prevent additional needs in mental and behavioral health moving forward. And then lastly, Emma recognized the importance of reducing stigma, as did Callie. And the mental health training is designed to build community capacity to respond to our mental health and behavioral health needs, whether that be through campaigns that are stigma reducing and/or trainings where we will be offering trainings and building the capacity of community partners to respond to mental health needs. Next slide. As you heard, all of these are rooted in what we've heard already in the community. And Adams County was strongly represented, as Emma demonstrated, in all that we've heard. We had some values that we carried forward in identifying these initial opportunities. 1, rooted in the assessments. 2, research informed. That means that we are looking at the evidence and what works, and we're going to build on that so that we are meeting people's needs, meeting the diversity of needs within our county, and using that research to continue to innovate. We're rooted in diversity and equity, and that will be embedded in everything. So we are listening to the community, understanding what's working with and for our diverse populations, and making sure that, as Natalie described early on, that we are achieving equity and justice within our communities related to these issues. All of these are collaborative in nature. We recognize the importance of that, as Emma has elevated. We need to create these systems of care. And they're designed so that we are evaluating all of the efforts. And the funding for these programs will go down through ARPA, and we will build funding so that we can sustain them moving forward by using the evaluations that we do and making the case for sustainability moving forward. And you'll see they address the spectrum as I illuminated. While there is a greater emphasis on care at this point in time, as we do our CHIP, we will build out and grow the strategies focused on prevention over time. Again, I want to recognize the importance of this work and all that's been done by Tri-County, and how excited we are to really emphasize now, take all those learnings and emphasize the focus on Adams County and our diverse populations. And with that, please reach out with any questions. There's a lot to come, and we're looking forward to working with all of you on it.
Thank you, Monica. So we are going to move us forward. I believe I saw a note that Susan had to go attend to a client. So Darcy, I think you're taking this presentation. Thank you so much.
Hi, everyone. Good afternoon. I'm so excited to share this program. It's one of my favorites. It is the grants within the harm reduction program are they allow us to be very creative and reach this population. So every time I think I've heard the craziest story, I get topped off every time we're talking and coming together. It's a ton of fun, important work, but it requires us to be fun and flexible. But I'll get started with what the program does. So we are doing a couple of things. This is a list of our services. We're doing syringe access and distribution and safe use kits, which is a variety of ways that people we find out are doing drugs, injection, smoking, or snorting. We also do education and distribution of naloxone. This is a very popular, very highly requested service that we go out and do to schools, libraries, community organizations, anybody who calls us to do naloxone training and distribution, we're there. Education and distribution of fentanyl test strips. This is fairly newer to us, but we're doing a lot of that, especially at community events. And we bring it along wherever we go. So we do offer it. And if, that's also something that I think will get more popular due to our fentanyl death rates in Adams County. Another thing we do frequently at our events and offer in some of our sites is HIV and hepatitis C testing. We do have a strong collaboration with our sexual health programs. We've cross-trained some of our staff to do both so that we just have a wider breadth of services. But within the sexual health clinic itself, we could do chlamydia and gonorrhea testing. We could also do those at outreach events along with treatment. Within the clinic, we could also do for patients who are coming in for other stuff or may have risk factors for HIV and syphilis. We'll do that testing also. One of the other things that we do is based upon some people who use drugs that do injection. We distribute wound care kits, but we also have accessibility to hygiene kits, period kits that we take with us wherever we go. We do distribution of condoms and we provide sex ed classes for whoever wants them. Next slide, Emma. Pretty much for harm reduction, we're at our Commerce City location on Mondays. We're going out to the community as much as possible, and we're doing community outreach events. The other thing that we have going on is we're flexible, so we're mostly in the field. So we're trying to look at, trails and working with other agencies that work with maybe homeless or people who use drugs. We're trying to figure that out and go where they need us. So right now, we also provide harm reduction at our Westminster office, where we're co-located with the sexual health clinic. So that's if somebody pops up on sexual health clinic and they think they could get referred to harm reduction, that's just right then and there. We'll see the patient right away. Or otherwise, if they're coming in for an immunization, we're like, hey, we have these other services, and we take them along to harm reduction. So where are we at now? We're growing our team. It's coming up. We're hiring every week for this particular program. Right now we're hiring we have in our grant to hire 2 harm reduction specialists. Our new manager just started yesterday. She did a similar program in Portland. So I think she's gonna have a lot to offer, and can't wait for you all to meet her and meet the team and meet our staff out and about in the community. We're developing our partnerships and learning about who's providing HIV care in Adams County for our HIV positive residents. We're also working with community partners to see who's doing drug treatment and how we could collaborate and provide a referral service, and trying to take a deep dive into that. Using all the other avenues that the HESI team is doing, trying to build upon their work. And then we are trying to do consistent outreach sites because we want to build trust within the community where they're like, hey, I know that if I go here on Wednesdays, I could take my syringes, I could talk to somebody. So we just want to create that regularity with being in the community. Our future plans are to continue to provide education and support to providers who may be interested in providing HIV care in Adams County. So we're reaching out to primary care providers, FQHCs, other providers like, hey, are you interested in doing HIV treatment? We'd love to give you the education, training, and technical assistance if you're interested in doing that. What we found, or what Tri-County found with HIV positive patients who needed treatment is they had to travel to get their treatment, and we'd like to get that closer to home. Our future plans are also to provide PEP and PrEP in our sexual health clinics. Next slide, Emma. So we are very thankful to receive one of the opioid settlements through the regional council, and we were awarded $747,000 and some change, I guess you could say, to increase access to harm reduction services and supplies in Adams County. We're also going to, again, build on the health equity team and doing some prevention programming. As soon as we get our check, I suppose, we're in the process of hiring 4 additional harm reduction specialists, and these can come from a variety of disciplines. Right now, our applicants are addiction counselors, people who've worked in the medical field and social work. So it's going to be a great variety in terms of this team. We are in the middle of purchasing our mobile unit to do community outreach. We went to the lots, checked out the trailers, and we picked our favorite that could meet all of our needs, where we could see patients in a nice relaxed situation. And that also has a bathroom so they could have privacy while they're doing their samples. So we're excited about that. We want to expand our footprint throughout the county because it's a big county. So we want to get to all corners and really assess the high-risk areas and provide consistent services. Again, that regular presence. We want to work with the schools to provide sex ed if they'll have us. We want to share our curriculum so there's more interest in us providing that. We want to do a fixed syringe access site so people will know that if we're not there, where they can go to turn in their syringes, keeping the community much safer than not using an access site. And continue to work with all the programs throughout the county to align services and provide referrals. So that is harm reduction.
Thank you, Darcy. We're going to move forward to Natalie Salcido again.
All right, good to be back with you all. I'm still Natalie. I just put on some glasses, so hopefully I'm recognizable, but good to be with all of you. We're going to talk a little bit about youth prevention, and to get us kicked off in that space, would love to just know and engage all of you in the chat. How many of you work with youth directly or indirectly? And you can drop a 5 in the chat. You can drop a fist pump, a high five, whatever works. Would just love to know who is working indirectly or directly with youth. Yes, two high fives. All right. And please keep them coming. We would love to know who is participating with us today and listening in. And with that said, Emma, if you'll go to the next slide, I'd love to just share a little bit about the current and future state of this work. We have the opportunity really to reimagine behavioral health and mental health, and we recognize the importance of addressing root causes of inequities. And moving beyond traditional concepts of treatment, crisis, and recovery services, which isn't to say that those traditional concepts don't have a critical role. It's just to say that we want to also spend just as much time on catching folks before they need treatment and recovery services. And so in the youth prevention space, this really looks like positive youth development and really addressing shared risk and protective factors that really influence and impact youth mental and behavioral health, youth violence, youth substance use, and deaths by overdose and deaths by suicide. You can see on the screen just a few examples of the current state of this work, really assessing youth-based and youth-driven, both formal and informal groups. So coalitions external to schools, coalitions within schools. You can see that we're building relationships and partnerships with schools. We do have a school-based policy and prevention specialist who is generally funded to just do that, build relationships and partnership with schools, connect them to resources, whether that be direct services or technical assistance. And then we also know that really to do this work, our health communication efforts or our messaging matters. And what also matters is who's actually giving that message. And so how do we create messages with youth and not for youth? How do we build capacity and skills and facilitate youth to be informed and identify their own solutions to their own priorities, mental and behavioral health being one of those? We will do this through youth coalition work. You can see at the end there's a Teens for Change Youth Coalition that Libby Harrington, who is a community policy and prevention specialist, who is facilitating that group and was doing this with Tri-County, and we've carried over here. And so we will also be working with youth coalitions and really bringing folks together to address youth engagement. And then finally, we also are providing technical assistance to schools to address inequitable policy practices and move from evidence-based alternative methods to discipline, recognizing the impact that suspension has on youth health and behavior change. And then thank you, Emma, for moving us to this slide. Future state of this work is to really develop a youth engagement strategy. Just listed a few examples. This is not comprehensive, and we will have much more time to discuss, but some examples are paid youth advisors, building those into our budgets so that we have youth at the table, pipeline to the public health workforce, recognizing that we want to move from a pipeline to the criminal justice system to a pipeline to our workforce. And then youth engagement webpage. This is another really great example of just engaging youth again in our messaging, recognizing that the message does matter and the messenger also matters. So with that said, I'm going to pass it off to you, Emma, to finish us out.
Great, thank you, Natalie. We are just rolling through this panel, a lot of different topics. We're excited to share many different things with you. Our next person sharing is Michael Reddick, and is our public health policy and public affairs senior analyst. He won the title of this group for having the longest title. Welcome, thank you, Michael.
Thank you, Emma. Good job not running out of breath. Yeah, thank you for having me. Super excited to be here. I think I've got 2 slides here, so we'll move through it fairly quickly. My name is Michael. I'm the Policy and Public Affairs Advisor at the Health Department. We're really lucky in Adams County. We're able to use every tool and lever to improve population health, including a really big emphasis on public policy change. So we work on federal, state, and local policy. But I'm going to talk mostly about state policy today because we're closing in on the last month or so of legislative session, and there's just not enough time to talk about all the incredible behavioral health legislation that we're seeing in the General Assembly. I will say at the front end, let me know if you're interested in anything. If you're hearing about legislation that you wanted more information on, I'm a full-time legislative staff person working out of the Capitol, working here in our office in Brighton. If you have questions on things, let me know. If there's interest in doing kind of a deeper dive into behavioral health specific legislation, also open to that. So just reach out. So like I said, we're into the last month of legislative session. Great opportunity through public policy to build bridges and to kind of strengthen or expand programming that's working at the local level, creating more agency, creating more resources for us to funnel down to those programs and make more impact. So each legislative session generally does have a maximum of 120 days, starts in January and ends in May typically. The General Assembly is made up of 100 legislators, 65 representatives, and 35 senators. The yearly budget and policies are created by these members. So the Joint Budget Committee, which is a group of 6 legislators, creates the yearly budget. They just sent that off to the governor yesterday. So we have a $38.5 billion budget ready to be signed by the governor. The rest of the legislators in general make up the policy committees that discuss and amend and create all the legislation that we see running through the General Assembly. The general kind of makeup of the Assembly this year, Democrats control the governor's office, the House, and the Senate. There's a supermajority in the House led by first-time Speaker Julie McCluskey out of Dillon, and there's a 23-12 advantage for Democrats in the Senate, led by Steve Fenberg from Boulder. Here in Adams County, we have 16 House or Senate members that represent a part or an entire district within Adams County, which is really beneficial for us because it gives us a lot of folks we can go to and ask for amendments or to improve bills or to vote yay or nay. To date, there have been 568 pieces of legislation that have been introduced. That sounds like a ton. In a way it is. It's about par for the course though. 74 have been signed into law. 76 bills have been postponed indefinitely, which means they failed to make it through their committee and essentially, kind of die on the calendar. With that many bills, there's just a ton of a lot of different issues that are going on. But when we're talking about the major trends of this session, it's kind of been dominated by big issues. Gun violence reduction bills have taken up a lot of time. Things like mandatory waiting periods, expansion of red flag laws. There was a package of reproductive health bills that codify protections for abortion and increase sexual health resources. So again, kind of connecting to that, to the programming that Darcy was talking about, and we took positions of support on all of those bills. Renter protections have been huge this year. There's more tenant advocates than ever. Probably the largest one you've heard about is the rent control bill, which has made it through the House and is still to be discussed in the Senate. And on behavioral health, there's a ton going on. There's the expansion of Good Samaritan laws. There's a bill that would allow overdose prevention centers, suicide reduction measures at universities, behavioral health administration cleanups, disordered eating bills, mental health screening assessments for school, 6th through 12th graders. To date, there's about 350 bills that are awaiting action, which is a lot. We kind of ran behind this year because we had a third of the legislature of the General Assembly were brand new, and we had a brand new Speaker of the House. Everything around the Capitol is kind of grinded to a halt. There's been a lot of filibustering. Republicans want to wind down the clock to that 120-day time limit and leave everything on the calendar. And that's tough because there's a lot of really good bills, including a lot that I kind of really quickly hit on, that still have to go through committees or go through the House or the Senate before they can be sent to the governor and signed into law. So we have, I think, 26 days left on the calendar to get through 350 bills. We'll see how that goes. How do we engage? Great question. We're one of the few health departments that have full-time legislative staff, which we're very, very proud about. It's a dream to be able to do that. We work in coalitions. We directly lobby. I'm a registered lobbyist, and we have another lobbyist who's at the Capitol on our behalf advocating for pro-health measures pretty much 24/7 at this point of the year. They're working through weekends. We testify at committees. We take official positions on bills. We look at all legislation through a criteria that was approved by our Board of Health. So we look at what is the impact on equity, on population health, on increasing capacity to our health department, and so on. So we take a really analytical lens before we take positions. So far, we've taken 27 different positions on bills. The photo on that slide is of a bill after a hearing that would increase sustainability for our Regional Health Connector program. Some of you may have worked with Regional Health Connectors here or at Tri-County, so that was a big win for us. We've worked on a handful of food security bills, harm reduction bills, and so much more. I'm kind of at my time limit here, but again, please reach out if you have additional questions. Again, I'm able to do this full time working with the General Assembly, so always available to chat, to go back and forth on email, to walk through some stuff if you're interested, or if you think there are places that we could be plugged in more, please let me know as well. And hopefully we'll work with you down the line.
Thank you, Michael. Awesome. Okay, so I'm going to take us here to the end of the hour. We have just a few minutes. I'm going to go through some of this very quickly. Really, the intention behind this section is just to let you know that we have been building out some of our communication tools. So this is a screenshot of our homepage for the Adams County Health Department. We are continuing to add new information as we speak, including things about our healthcare services, like what you heard from Darcy, many of the efforts that we have today, talked about our amazing epidemiology data systems team has really been working on building out a number of data dashboards and other areas. So we just encourage you to check out the website. As I mentioned, we have some new specific web pages under this website relating to mental health and substance use, including our harm reduction and HIV prevention page. We have a mental health promotion and a substance use prevention web page. Both of these right now are kind of flat list styles, but we're really working on making them a little bit more dynamic and with visuals, but they do include lists of a variety of resources for all types of things, including treatment directories, direct crisis service information. You can also go to this website to link to our mental health and suicide prevention frameworks. Again, the syringe access services page is on there as well. So you'll have all these links to go and explore. My last piece here is just to point out here on the bottom right of the page that we have newly launched mental health and substance use data dashboards. These are just beginnings. So they are kind of our first attempt at putting some data out to help us understand these issues in Adams County. We will be engaging with you all and community members to give us feedback on all of this content. So we really want to spend some time with you to better understand what data needs are coming from you and from the community. How can we better meet those needs? How can we ensure that the data is useful to you in whatever capacity you are looking at? So please know that we will be inviting you all to join us in engaging with improving these communication channels and resources. But we have a start for now, and that's been pretty exciting given that we are really only about 3.5 months into our agency. So great to have some of those tools. My last piece here is really just to recognize that we've been talking about Adams County Health Department all meeting, and we want to recognize that we are not the center stage. There is a ton of great work happening out in the community. You all are doing wonderful work. I know that we have several of our community-based organizations that are participating in this Anti-Stigma Ambassadors project on the call today. And just wanted to give this as an example, a highlight of one of the really great partnership projects that we have going with you all to address stigma. So I'm not going to go through this model, but just want to call out a couple of things. One, we have worked to identify community-based organizations who are trusted messengers and community leaders as our ambassadors for messaging around stigma. We are supporting, and by we, I mean Adams County Health Department, along with a number of other local health departments and health plan organizations that are all part of Metro Denver Partnership for Health, to really build out a model that uses this trusted messenger approach to engage with the community to address particular issues. So some of the ambassadors that are participating currently have tailored and made culturally relevant mental health materials and promoted them. They're doing local level data collection and message testing. They're hosting mental health events, doing all sorts of communication, and much of it is really centered around the Let's Talk Colorado campaign, which has been around for a while, but you may notice has had a pretty significant refresh, and a lot of this was based on the information and the feedback that we received through our ambassadors and the community members that they're serving. This is just a quick snapshot of the reach of this program. And I will just say that what we have learned and what we are building on is that involving community as the trusted leaders to do the messaging works. Our participating ambassadors have improved their confidence and knowledge in promoting mental health messaging. And we've really been applying a lot of flexibility, continuous learning, and adaptation to improve the program. There will be a third round of ambassador grants coming about this summer. If you want to learn more, here's a link to the report. In the last minute that we have here, I just wanted to come back to this engagement continuum and recognize that we spent all day pretty much on the left side of this continuum because we are so excited to let you know about who we are and what's happening, and to ensure that we're really doing some level setting with our partners. We will be moving to the right on this continuum, and you will be hearing from me and our team for future opportunities to engage, where we will really have time and space and mechanisms to hear from you about what's going on in your work, what you're seeing and hearing in your communities, and how we can work together to really implement those frameworks and some of the principles that we spoke about earlier today. All that to say, we really encourage you to please keep adding to the Jamboard. We're going to keep that open for at least another week or so. And we will be sharing what you all contribute to that. We are going to be giving you a survey, and I think Surya is going to drop that in the chat if he hasn't already. We would love to hear from you. We will be sharing information from today's meeting. We encourage you to check out our website and the data. And we're just really looking forward to working with you going forward. The last slide here is just contact information from everybody that you heard from today. Please reach out to us. We want to talk with you. Questions that came up on the Jamboard, we will be circling back around and answering. And we just really appreciate your time and your attention today. It's so great to see so many of you, and we hope you have a great rest of your day. Thank you all so much.